I went in just before Christmas to have a cardioversion done with Dr. Yu, and while he was in there doing that, he decided to order the vest for me as a precaution. I was at home, I was feeling fine. It was 10 in the morning. All of a sudden the alarm went off on the vest. And they had explained to me, if the alarm goes off and I'm awake, you just stop it so that it doesn't shock you.
Press response buttons to delay treatment.
And I didn't even have time to stop it, and I passed out.
Bystanders, do not interfere.
I woke up to the alarm still going off and saying that he had given treatment and to call the doctor.
Call ambulance.
If the vest would not have shocked me, I would not have revived.
First time she came to me was for atrial fibrillation, or a condition in the top chamber where she was feeling irregularity in her heart. That condition in itself does not kill you, or is not a fatal condition. However, we were quite lucky to fit her with the LifeVest because we were able to find that she had a cardiomyopathy, which is where the heart was weakened, so that we can fit her with that external defibrillator jacket and in fact save her life when she went into electrical disarray. So this is our printout of her arrhythmia. She's actually in a normal rhythm here, starts to have some extra beats come in play. A couple of seconds in, less than 10 seconds into this episode, you can see that she goes into this different arrhythmia, and this is actually ventricular fibrillation. This is the stuff that causes cardiac arrest. She's in this for several seconds more. As you can see, the device then detects it here. It gets a lot faster, in fact, over 300 beats per minute, which is obviously not a survivable rhythm. So once it detects it, appropriately charges the battery packs, and you actually get a shock right here, and that converts her back into a normal rhythm.
So I called 911, and while I was on the phone with them, the alarm went off again and I passed out again. And so then I woke up to, I could hear the alarm and the 911 operator calling my name out. And then once the paramedics got there, at some point I went out again with the vest on, and it shocked me again. So it shocked me 3 times, the vest.
I didn't know whether or not she'd be that one that needed to have a life save, if you will, but because we're just providing insurance, if you will, this patient needed it. In fact, in less than a week, she then needed it for cardiac arrest over and over again. It saved her life. Without it, she would not be around.
So these are the big charging, or that do the defibrillation, and then these all just monitor you when it's going. And then this here, this is every time before the alarm goes off, it does a vibration, so you kind of know something's coming. I want to thank Dr. Yu for having the vision of giving that to me. But we had just moved from McKinney out to Ponder and bought a little farm and plan on getting animals, and that's kind of our dream, to have our little farm. So I just have too much to do still.